Hey, it's Cory Bergeron, and we're discussing something incredibly important today, which is opening the airway and treating sleep apnea, but not in a way that you've ever heard of before. It's a new product line called Vivos, and I'm joined today by Dr. Paul Eckstein. Now, Dr. Paul is a best-selling author, has his own dental practice, and more importantly, really has been at the forefront, the spearhead of this new Vivos technology. We have him here today. Dr. Paul, thank you for being with us. And I guess I need to start right at the beginning here, okay? What is sleep apnea?
Sleep apnea is a period when you're sleeping where you stop breathing for 10 seconds or longer. That is the definition of an apnea.
That sounds terrifying.
It is terrifying, actually.
So how many times could that happen to a person throughout a night?
The highest number I've seen is around 125. That would be uncommonly high.
Oh my gosh.
In my patient population, the highest I have is about 85, 88.
85 times. It makes it sound like, I mean, if you stop breathing, obviously you're not getting good sleep. That doesn't sound like somebody who would sleep at all.
You're probably not getting into REM sleep, certainly, if you're doing that. If you're not getting into REM sleep, you're not getting reparative sleep for your brain.
Yeah.
You're also secreting a lot of hormones like cortisol, epinephrine, probably your oxygen saturation, meaning if you have a pulse oximeter in your finger in the hospital and it drops below 90, the nurse is going to come running to the room.
That little pulse thing you put on the right little, okay, got it.
Yeah, so if that, I've saw a sleep test yesterday that went to 82. So.
Wow, wow, okay. So, of course, we know that one of the biggest indicators of sleep apnea, at least, I've heard it many times, even from my own family members, snoring is associated with sleep apnea. But if I snore, does that just automatically mean I have sleep apnea?
Not necessarily. Some people can snore and not have sleep apnea. I would say about 50% of the people who snore do have sleep apnea. And the only way really to know is to do a sleep test. And nowadays it's easy to do one in your own home.
Really?
So yeah, we can do one through. I do the patients all the time, or I have a third-party provider. We can have them sent to you in the mail, and you can just.
That's really cool. I didn't know that was available. I know that years ago I looked at having a sleep test done, and I was thinking to myself, am I actually even going to be able to sleep there? Because they're going to put you in kind of a foreign environment and hook you up and everything, and I was afraid I wouldn't even get accurate results if that happened. So that's really neat that you can do it in your house. Let's talk. Let's just loop back around here to sleep apnea itself. So I know you said about 50% of people who snore are most likely going to have sleep apnea, but are there other things besides snoring that are going to affect my health in regards to sleep apnea?
Certainly. We treat, I'm going to back up there just a second, and the very first thing we want to see is we want to see nasal breathing. We want to make sure you're not a mouth breather. Being a mouth breather or breathing through your mouth, particularly when you sleep, has some adverse health effects. Everything from allergies, enlarged adenoids, asthma could be
allergies?
Allergies,
really?
Absolutely.
Just breathing through your mouth could give you greater allergic reaction to what? Things that are in the air?
Pollen, dust, pets.
Because your nose is filtering.
Your nose is filtering.
Okay.
And now your lungs and your adenoids and your other tissues are doing the filtering that your nose is supposed to be doing. And humidifying. One of the functions of the nose is to humidify and warm the air before it gets to the lungs.
I didn't know that. No kidding.
Yeah. Yep.
Okay, so are there anything, is there anything like physiologically with my body or somebody else's body that would say that they are specifically at risk for sleep apnea?
Wow, there's quite a few things. On one of the main questionnaires that we use for insurance, there's, if you're a male, age 50 or older, neck circumference over 16, and a body mass index over 30, you're kind of in the sweet spot. So you see somebody with a forward head posture, that's a dead giveaway. Venous pooling under the eyes would be another thing that you might see.
Okay.
As a dentist, there are some things that I see intraorally pretty easily that I can recognize there might be some breathing issues going on that I kind of screen for in 30 seconds or less. But,
okay.
Yeah.
So when sleep apnea is the case, when this occurs, talk to me for just a moment about what's actually happening in the airway. Like you're saying, it's a restricted airway. How is it that when I'm standing up and walking around throughout the day that it's not affecting me as much? It happens when I'm sleeping at night.
Two things on there is muscle tone relaxes when you get into stage 2 sleep.
Okay.
As soon as you go into stage 2, your soft palate's going to drop. Muscle tone is going to relax, and the soft palate and the tongue is going to fall back. The number one constriction or thing that causes sleep apnea is going to be the restriction of the tongue on the back of the throat, or what's called the retroglossal airway.
I see your eyes are darting down here to the table. I know that you brought these like alien-looking things here. I'm going to pick them up for a sec, because I think that's pretty much what we're looking at here, right? Can you tell everyone what I'm holding here?
Those are two 3D printed airways. They are upside down, but that's okay.
They are okay. There we go. Do it. Right, just like that. There we go.
So this curvature right there, that would be what's called the retroglossal space. Retro meaning behind, glossal meaning tongue. That is the space behind the tongue. Okay. And so as you hold it vertically, that would be a person standing upright. But if you can imagine that is a collapsible tube, that person lies down and that tube is going to collapse even more. So if that was a snorkel that you had to breathe through, it's going to be very difficult to breathe through that.
Right.
So that is a pre-treatment 3D printed airway.
Okay.
And the blue one is a post-treatment 3D printed airway.
Okay, so this is literally before and after.
Yes, sir.
That I'm holding right here. The blue one is the after. I mean, that's that's unbelievable. Look at the size of that. And what's incredible about it is actually I can feel it. Like if I flip them sideways and you take a look, if you're lying down, how open is your airway? How much air can get through there? I mean, you can see how this one right here is just so much broader regardless. So this, when we're talking about the before here in the red and the blue and the after, the difference is Vivos, because Vivos is the treatment that was provided here to provide the after. Correct?
Absolutely, correct.
Okay, so talk to me, show us for just a moment, what are we talking about when we're talking about Vivos? Show me what this is. What is Vivos?
Vivos is a unique, I hate to use the word revolutionary system, but it's the only system of its kind that's non-pharmaceutical, non-surgical, that's going to actually grow bone, recontour the upper and lower jaws, and help recontour and open the airway so that we have a solution that will get you improvement and not just a Band-Aid over time. It's an oral appliance that I have one right here.
Okay.
It's an oral appliance that you wear 12 to 16 hours a day. And this is going to stimulate stem cell activity to help grow the maxilla.
Stem cell activity?
Stem cell activity.
Really? Yes. Hold on. Let me see this for just a moment.
Sir.
I'm going to hold it real still for our camera so they can take a look at it. How is this stimulating stem cell activity? Explain that to me for a moment. How's that happening?
We're using passive force and resonance on these springs that you see on the front there.
Yeah.
There are stem cells available in sutures in the body, and by sutures I don't mean like you got stitches, but sutures where bones come together.
Yep.
So the mid-palatine suture is one right down the center of the palate.
Okay.
And then in the periodontal ligament that's around every tooth, there are stem cells available there as well.
Good Lord. Okay, so it sounds incredibly technical, but basically I put this into my mouth. It stimulates growth of bone, my palate, my jaw, and I mean, does it change the look of, I would think that change the look of your face over
Absolutely,
time?
it certainly will.
Really?
Yeah,
for the better, maybe?
For the better, absolutely, yeah. For most people.
All right, so let's talk about snoring for just a moment here. Okay, I understand that this is going to help treat snoring, and you have a lot of success in doing this. You have patients that have come back to you after treatment and said, I don't snore anymore. It's gone. I know you're one of these patients.
I am one
You've
of these
explained
patients.
this to me.
Yes.
So you're one of your own best testimonials on the success of the product. But explain to me, is it just for snoring, or are there other things that can be affected by using Vivos?
Well, if you look at this right here, that's the roof of your mouth, obviously, or the hard palate. That is also the floor of the nasal cavity. So if you're narrow and this is your palate, your nasal cavity is going to be narrow and restricted as well. So upper airway resistance syndrome would be something that would benefit. And that's one of the ways that we help get people back into nasal breathing rather than mouth breathing. If you can expand the maxilla or the upper jaw and expand the palate, you can actually widen out and open up the nasal passages as well.
Oh my gosh. Wow, that's incredible. Okay, so I have to ask you, there's been a lot of buzz about this in the media, social media, you've seen it on the news. Why do you think it is right now that we're hearing so much about sleep apnea?
Well, I think part of it is just there's more awareness on a lot of things on social media, and we have a lot more ways to get information nowadays. In dentistry in particular, we're in the golden age of imaging, and so we're able to measure things that we weren't able to measure maybe 10, 15 years ago on,
Really?
on CBCT scans and things like that.
What is that? Explain to me what that
That
scan
stands
is.
for cone beam commuted tomography. It is like a it's like a CAT scan, but it's digital.
Okay.
And so it's a 3D X-ray of your head and your airway, and we're actually can make volumetric assessments of the airway and measure those things. Where 15 years ago we couldn't do that. So we could do this treatment and people felt better. Now we can measure those changes and know that we're actually making the things that we thought we were. And so
So is that where this came from? Is using that type of scan to make a 3D model?
that is 100% where that came from.
No kidding. Wow, that's incredible. So there's huge advancements in technology, being able to actually measure the internal airway of somebody and create a
Yes.
model so you can actually see it firsthand and see those changes taking place.
Yeah. So the research has been going on for years, and now the jury's kind of in, so to speak, that we know through this imaging that we're able to make these changes and actually improve things. We can get non-subjective numbers on these things that we know that it's working.
Just really laser accurate.
Laser accurate.
Laser accurate. All right. So, how is Vivos like? Are there other products that are designed to do this on the market? And if so, how's Vivos different?
Vivos is the only product, at least that I know of, that is doing these kind of changes that we just talked about.
Really?
Historically, there are dentists that treat sleep disorders and sleep apnea, and if you're somebody that has a CPAP or a machine that helps you breathe while you sleep, and you don't like it, can't tolerate it, we would make a device that would take your mandible, move it down, forward, and that'll help open up the airway. But again, it's not addressing the root cause or the underlying problem. It's important because it's helping you, stay alive. It's helping you breathe while you sleep, but it's not really getting to the underlying issue and helping correct that.
Okay, so explain to me, because I've heard this term thrown around a little bit, and I'm still a little bit in the fog. I don't understand what AHI is. Can you please explain what AHI is for myself and for everyone watching?
Okay, so if we gave you one of those home sleep tests that you were going to go home, AHI is going to be the primary thing that we're looking to measure. It's your apnea-hypopnea index.
Okay.
So an apnea, as we mentioned earlier, is when you stop breathing for 10 seconds or longer.
Right.
Hypopnea is just when you stop breathing for 1 second, 2 seconds, whatever. And so that index is going to be gauged in a number per hour of times or events that you have in an hour.
Okay, yeah, I heard you mention that. So this is the term for that, and this is the result of a sleep test.
As a result of a sleep test, yes.
Okay.
So if you have an AHI under 5 or apnea-hypopnea index under 5, that would be not considered sleep apnea. 5 to 15 would be mild. 15 to 30 moderate, and anything over 30 would be considered severe sleep apnea.
I gotcha. Okay, so you had mentioned that Vivos is really getting to the root cause. It's treating the source of the problem. A lot of people use CPAP machines. Okay, now I'm familiar with this. If our viewer's not familiar with this, what is a CPAP?
In general terms, a CPAP is a machine that facilitates breathing, whether it's through a mask that covers your face or a cannula that goes through your nose, and it stands for constant positive air pressure. And it's just keep forcing air into your airway so that your oxygen saturation that we talked about earlier doesn't drop.
Right, and I've seen, like my father used a CPAP machine, and I'm familiar with what that looked like, and I never actually saw him wear it. I just saw it next to his bed, and I thought, there's no way that's comfortable. Like that is, how does he even get any rest with that?
Yeah.
The tube, coming out of that thing. And so I have to ask, a lot of people have CPAP machines, and they really don't like it. Can this be used as a substitute for a CPAP machine?
Short answer for that is going to be yes. But I'm going to preface that by saying that depends on what your AHI that we just talked about is. If you're in the high severe range, I would never advocate somebody just discontinue the use of a CPAP.
Okay.
Our main goal is to keep people alive. What we do is we want to make people feel better, have better quality of life.
Yeah.
In the short term, we want to keep people on their CPAP, get them fitted with an appliance, get them wearing it, and as they wear it and a sleep test warrants, we can wean them off their CPAP.
Okay, that makes sense. So, you mentioned the different demographics of people that are suffering from sleep apnea, and I guess what I want to know is, does this affect everybody? Or you had said, mostly men over 50. You had some specific parameters: size of the neck, size of your body mass index. What is the most surprising demographic that you actually see sleep apnea in?
Children, actually.
children. Now, I'm a dad. I have 4 kids. I would never look at any one of my 4 kids and think that they have sleep apnea. How is it that, explain to me what that looks like in a child, and how is that demonstrated? Like how can a parent look at their child and say, this could be a breathing disorder, I need to take a look at this?
Well, I think the easiest way is, does your child snore at all? And then a lot of times, mothers in particular look at their kids and go, oh, isn't that cute? But that is actually a disorder just like it is in adults.
Yeah.
Nasal breathing would be one thing. Is your child sleep with his mouth open? Are they breathing through their mouth at night? That can have some long-term effects and some skeletal abnormalities in terms of
really
the way they develop. Absolutely.
Okay.
So all those things, you just want to observe your kids when they're sleeping. Do they witness them stop breathing at all? That would be another way.
Okay.
But, yeah.
So looking at a child, if you determine that your child actually had sleep apnea and needed treatment, if you were to treat your child with Vivos from a young age, would that then negate the possibility of sleep apnea later in life, or is it possible it could recur?
I think it's always possible things can recur because there's a very close relationship between weight gain. So if you became obese as an adult, that aside, this is if you get a child developing properly skeletally and we address the underlying issue, the answer is yes. That would most likely negate the possibility that they would have that as an adult.
All right, so you mentioned something to me earlier that I found really, really shocking. You said that there are quite a few other things that it could be a result of having sleep apnea that most people wouldn't even recognize. Things that you think are a problem in themselves, but they could actually be occurring because that person has sleep apnea. Can you just give us some examples of those things?
Yeah, and I'm just going to say breathing disorders and not even sleep apnea. It doesn't necessarily have to be sleep apnea. But I'll start fibromyalgia, diabetes, stroke, heart attack, dementia is a big one, AFib.
Dementia?
Dementia.
Really?
Yes.
And is that because of a lack of oxygen to the brain? Or I'm trying to put that together.
That's certainly never good. The big relationship between dementia and sleep apnea has to do with a protein called beta amyloid. And beta amyloid is a protein that builds up on our brain while we're awake and should be removed while we're in REM sleep. And if you're never getting to REM sleep or you're getting interrupted sleep, that protein isn't removed and being regenerated properly.
Wow.
Yeah.
Okay. I never could have guessed that. I thought diabetes stood on its own 2 feet, and that was it. That diabetes was what diabetes was. That's amazing to think that it could have that as a root cause. So listen, incredible technology here in Vivos. I've never heard of anything like it before. I've mentioned it to a few people I know, and it's amazing because everyone I mention it to, they either have a need for it themselves or in their immediate family know somebody who they want to get tested because they need this technology. So I'm really glad it's here with us. Please tell our viewer, if they want to know more about Vivos, where can they go? Where can they find out more?
Okay. First place would be www.vivoslife.com.
And Vivos, V-I-V-O-S.
V-I-V-O-S. That'd be the first place. You can go to my website, www.dental, D-E-N-T-A-L, online.com, be the second place. Or you could join us at a workshop monthly. If you go to our website, you get more information on our workshops.
Awesome.
You can attend one of those, and it's just an information only. You can't even buy anything while you're there. So.
I appreciate it. Thank you so much for bringing all this info
My
to
pleasure.
our viewer and really educating me today. This is awesome. Thank you for being here, Dr. Paul.
Thank you, Cory.
All right, take care. Thanks for watching.